So the obvious question arises, when would you start phototherapy in neonatal jaundice? Now, starting phototherapy, defining a minimum bilirubin when you should be starting phototherapy depends upon multiple factors. It firstly depends upon the gestational age of the child. Secondly, it depends upon what day of life the child is, that is the age of the child. And thirdly, obviously, it will depend upon the total serum bilirubin as well. In addition, presence or absence of risk factors which can affect the ability of blood-brain barrier to allow molecules to pass will also be a minor determinant when you should be starting phototherapy. So to keep it simple, you can divide it into two parts. The first category is babies who are having neonatal jaundice but who are born at or above 35 weeks of gestational age. So children, newborns who are born at or above 35 weeks of gestational age, in these babies, you will consider starting phototherapy based upon American Academy of Pediatric normograms. So there are AAP normograms. There are separate normograms have been given by American Academy of Pediatrics. One normogram is for when to start phototherapy. One normogram is when to start exchange transfusion. In both the normograms, on the x-axis you have age of the child. On the y-axis you have total serum bilirubin of the child. And there are three curves. There is a high risk curve, there is a medium risk curve, and there is a low risk curve. Based upon the presence or absence of risk factors, the gestational age of the child, you will plot on the curve at what age, what total serum bilirubin is, and then you will take a clinical decision. So at or above 35 weeks of age, you will take the help of AAP normograms, right? More on this we will discuss in some time. In children who are born prematurely before 35 weeks, the evidence is less robust and no specific normograms, no consensus on normograms exist. So what we usually follow is the standard cutoffs. There are tables which are there which take into account how premature the child is and what total serum bilirubin value is there, and based upon that you take a clinical decision. Day of life becomes relatively less important when you talk about less than 35-week babies. So let us move further and try to talk about these babies first of all. Now, as you can see in this picture, there are two normograms. Both of them are American Academy of Pediatric normograms for the management of indirect hyperbilirubinemia. Now, one normogram relates to when to start phototherapy and one relates to when to perform exchange transfusion. If you see both of the normograms, on the x-axis you have the age of the child which is mentioned, and on the y-axis you have the total serum bilirubin which is mentioned. Similarly, in the lower chart also a similar pattern is being followed. Most of the times you will be given a chart which will mention whether it is a normogram to follow for phototherapy or it is to be followed for exchange transfusion. But I have seen residents often get confused when such a labeling is not there. So how to remember? There is a stupid cheat code that you can remember. See, always look at the lowest line first of all. What is the lowest line? You can see the lowest line. These are the three lines. The upper line is called as the high risk curve. The middle one is the medium risk curve and the lowest one is the low risk curve. In case of normogram related to phototherapy, in the first 24 hours, the lowest line will always be solid, as you can see in this picture. Can you see that it is solid in nature? In case of normogram of AAP, which is related to exchange transfusion, it is always a broken line because the evidence in this area is not robust, and so AAP uses a broken line to denote. Second thing, in certain computerized forms, this broken and unbroken line difference will not be there. So remember that in exchange transfusion normogram, the cutoff for starting exchange transfusion at 24 hours will be 15 milligram per deciliter of bilirubin. In case of phototherapy, it will be somewhere between 5 to 10. So these are the two ways in which you can distinguish that this is the normogram related to phototherapy, this is the normogram related to exchange transfusion. Since we are not talking about exchange transfusion here, so we will not talk about this. Let us discuss this normogram in details. Now this is the normogram. So what you will do? What you will do is, you will have the child in front of you. Child should be, gestational age of the child should be 35 weeks or above. In such a child, you will look at the age of the child. Then you will look at the total serum bilirubin. You will not subtract the direct bilirubin from the total value. You will only look at TSB, that is total serum bilirubin value, and then plot on the chart, right? After plotting on the chart, which line is to be considered? That will depend upon the presence or absence of risk factors and gestational age. The uppermost line is called as high risk. गड़बड़ हो गया, पिछला डायग्राम गलत बता दिया, पिछला वाला दोबारा करना पड़ेगा, कट कर दें इसको. Now these are the two American Academy of Pediatric normograms. One normogram, the one which is shown in the top, is the one which is related to when to start phototherapy, and the one on the lower side is the one which is related to when to start exchange transfusion in the child. Let us try to see, let us take one of these charts and try to understand the various parts of this chart. As you can see that in both the charts, on the x-axis you have the age of the child which is mentioned. So birth, 24 hours, 48 hours, 72 hours, etc. On the y-axis you have the total serum bilirubin which has been mentioned. Please remember that when you have to start phototherapy or when you have to consider exchange transfusion, you don't take into account what is the direct bilirubin value. It is the total serum bilirubin which is to be used, right? Then you can see that there are three types of charts, three types of lines which are there. The topmost line, which is dotted line, that is called as the low risk line. So these are the babies who are at low risk. In them, a slightly higher value of total serum bilirubin can be allowed, can be accepted. So the highest line is usually called as the low risk line. So this one is the low risk line, right? Low risk line is followed for babies who are born at or beyond 38 weeks and they are well. They don't have any risk factor, right? Then we have the middle line which is called as the medium risk line. Medium risk line will be used for babies who are born at or beyond 38 weeks with some risk factor, or babies between 35 to 37 weeks but have no risk factors. And the third line will be the high risk line. This will be followed for babies between 35 to 37 weeks who are having one or more of the risk factors. So similar interpretation you can do in the normogram for exchange transfusion as well. We will not be going into details of this exchange transfusion now. We will be focusing our attention on this flow chart. Now, most of the times when you are there in the wards, when you are managing the child, now most of the times in the charts which are provided to you, it will be written that this is the normogram for phototherapy, this is the normogram for exchange transfusion. It will be written there. But sometimes if it is not written there, I have seen residents get confused. There are two ways you can remember. One way to remember is that always look at the 24-hour value. So 24-hour value in this chart and look at 24-hour value in this chart. In case of exchange transfusion chart, the minimum cutoff to start exchange, to perform exchange transfusion in the lowest solid line will be at 15 milligram per deciliter, right? Whereas in case of phototherapy, it will be between 5 and 10. You can see here, it is lying somewhere between 5 and 10, right? Second way, which is again very easy to see in case you have chart lying in front of you, look at the high risk zone, the solid line in between birth and 24 hours. In case of phototherapy, the evidence is robust and so they use a solid line here. If you see in exchange transfusion normogram, you will find that a broken line is being used here as well. The broken line here basically means that the evidence for exchange transfusion in first 24 hours, even according to app normogram, is not that robust, and so conventionally they use a broken line here as well. So सबसे नीचे का line, if it is broken, that is exchange transfusion normogram. If it is a solid intact line, the lowest one, then it is a phototherapy based normogram. Small little things. End of the day, you know everything, but small little things which can sometimes make a difference when you sit in your exams. So we'll not be talking about exchange transfusion. Let us focus our attention on trying to understand this normogram. Now have a look at this normogram. You will find that a baby comes to you. The baby's gestational age is 35 weeks or above. You will take the total serum bilirubin and try to see what is the age of the child. Based upon age and based upon total serum bilirubin value, you will plot on this chart. After plotting this chart, which line should be used as a reference will depend upon these three things which are mentioned, whether it is a 38-week child or above, whether it is 35 to 37-week child, and the presence of or absence of risk factors in the child. Before we go towards clinical scenarios, let us try to look at the risk factors which determine which line is to be used. Now, the risk factors to determine which line is to be used in normogram include the following. First of all, presence of autoimmune hemolytic disease is considered a risk factor. Secondly, G6PD deficiency is considered a risk factor. Thirdly, you have asphyxia. Fourth is sepsis. Fifth is your acidosis. Sixth is hypoalbuminemia. When you talk about hypoalbuminemia, serum albumin cutoff of 3 gram per deciliter is to be taken in case of newborns. So, serum albumin level less than 3 gram per deciliter will be considered to be a risk factor for using the higher risk curve. Temperature instability or hypothermia, and last but not the least, significant lethargy is also considered to be a risk factor. So, presence of one or more of these risk factors changes which line in the normogram you are going to use. Now, let us take the help of some examples to simplify whatever technical things I have just told you. Now, look at scenario number 1. A 39-week healthy female infant has TSB of 12 mg per deciliter at 72 hours of life. Phototherapy to be started or not? In all these questions or all these clinical scenarios, you first have to see, you will use these normograms. You should move very systematically when you get a case like this, whether it is a question, whether it is a clinical scenario or it is your examination. So, first of all is you have to see whether a correct normogram is being used or not. As you can see, it is a correct American Academy of Pediatric normogram which has been provided, right? After that, you have to see that normogram is to be used only in babies born at or above 35 weeks of gestational age. This is a 39-week child. So, you can use this normogram safely. Now, whenever you have been given the age of the child in TSB, before thinking about presence or absence of risk factor, always first plot where is the graph line. So, what does the question say? At 72 hours of life, female infant has TSB of 12 mg per deciliter. So, this at 72 hours of life, this is the 10, this is 11 and this is 12. So, this is the point at which total serum bilirubin value is being plotted.